Hello and welcome back. And today I want to talk about POTS. So, a couple things. Probably if you have been researching long COVID, you have long COVID, you probably know a lot of this, but hopefully there's something new and helpful. So a lot of this information I got from a lecture I went to. So I'm a physical therapist, and our California Physical Therapy Association had a class on long COVID from this physical therapist, Dr. Todd Davenport, and I will link that below. You can purchase it. It was honestly the best information I've gotten. Most of my doctors don't know what they're doing. I even consulted with a functional medicine doctor, and she didn't know half the things I know. So that's why I'm making these videos to share with you. I think as a non-clinical person, you could understand a lot of this lecture if you're interested looking for some other resources. I will also link other resources below. If you have any resources you've used, I would love for you to share them and help others out. So POTS is, I think a lot of people have heard about this with long COVID. It stands for Positional Orthostatic Tachycardia Syndrome. So what it means is positional, like when you go from laying down to standing or from sitting to standing. And then orthostatic means your blood pressure drops with that position change. Tachycardia means your heart rate. Tachycardia is a fast heart rate, so your blood pressure drops, your heart rate increases, and syndrome. So this is something that's been around before long COVID, and as a physical therapist, we sort of understand this and we've seen this. So in the hospital setting, a lot of people after surgery get what we call orthostatic hypotension, meaning their blood pressure drops, they get dizzy, and it's with positional changes. So as a physical therapist, we've known about this and done it for a long time. So it's in the hospital, usually people with surgery or people with that have been really ill and in bed for a long time and their body's all out of whack, right? So with long COVID, the virus is wreaking havoc on your body. So it's a little bit different, but same thing, sort of it's under this umbrella term called dysautonomia, meaning your autonomic nervous system is out of whack. And so, people with POTS, usually when they get up, they feel dizzy, lightheaded, woozy, maybe nauseous. And so there's a couple things we can do. And so wearing compression socks. So I've been wearing long compression socks to my knees since this started, and it helps somewhat. But actually for POTS, what I learned in this class was you should wear compression to your waist. So compression leggings. And I can link some below. So, think about some sports brands of compression leggings. That's a possibility. I'm a pelvic floor physical therapist, so in my world, for a lot of moms during pregnancy and postpartum, they buy these special brand of leggings that are compression leggings that kind of help with the swelling that they might get in their feet. A lot of times after having a baby, they feel whoa, my abs, my core is really whoa, there's just no stability there. So with POTS, what's happening, you get up, your blood pressure drops, the blood goes to your feet and it can't get to your head. So that's another thing I learned in this is there's actually this sensor that someone invented that you put on your ear that measures blood flow. So they've shown this in studies that as you get up, the blood pressure drops, your heart rate increases, you get symptoms. So it's can be very severe. Some people get discoloration of their feet, that's the abnormal blood flow when they stand up. And so it's called Lumia Health, is this ear clip that can monitor the blood pressure to your head. So that's why you feel dizzy. So the compression all the way to your waist helps get that blood flow back up to the upper part of your body and your head. Also, they talked about some what we call abdominal binders, or in the outside world, we might call it waist trainers. So we're not trying to suck it in for aesthetic looks or weight loss, but to keep some compression Basically, that's how our blood vessels work. They compress to sort of like bring the blood flow back up, right? Our veins compress to bring the blood flow back up. Arteries are open, they go down, they don't go down, they go away from the heart, and the veins go towards the heart. And so some extra compression doesn't let the arteries like expand as much for so much blood to go down. And it helps as the veins pump the blood back up, it helps sort of with that process. So compression leggings, waist trainers, or in medical terms, abdominal binders, which a lot of people find them uncomfortable, which again, that's something I use for my patients in pregnancy and postpartum. And yeah, they're kind of uncomfortable to move around in, so people don't love them, but that's another thing you can do. Another thing is compression recovery boots. So I'll put a picture here. But in the sports world, these have become really popular in the last few years, like to use these as recovery, right? They help pump the blood flow back to your heart, which in sports and athletics, fitness, when you exercise, all the blood goes to your muscles, your extremities, and those blood vessels are really open. And then after you finish your workout, these compression boots help pump that. There's it's mechanical, it's you plug it in and it's like a pump. So if this is my leg, it pumps all the way up, right? It pumps in this succession. So that's something you can do. Lymphatic massage also can be helpful. So again, these compression boots are I first saw them in the healthcare field when I worked with breast cancer patients that had lymphedema. And then they use these compression boots, you can get them for different body parts. But so a lot of people say the compression boots and the hip compression recovery, I don't know what you call it, they're not boots, but so lymphatic massage is a certain type of massage. It's kind of weird. It's a lot of light strokes, but then it's compression to help pump the fluids back to kind of rebalance that. So those are kind of the things you can do. I also tell patients there's some simple things too, before you stand up, can you pump your toes, pump your ankles, do ankle circles, up and down, circle, circle, right? We're trying to preemptively get that blood flow going again. Maybe don't pop right out of bed, right? Maybe you gotta sit for a minute, pump your ankles, pump your feet, right? Do some kicks. Again, trying to get that blood flow back up to your heart and your head. And then when you stand, again, same thing. Maybe you stand in place, don't pass out, please. But can you march in place? Can you go up and down on your toes? Things like that. Again, getting the blood flowing back. And then another thing you can do is if the rest of your body is healthy, increase your water intake. So that will help with what we call vasodilation. So keeping those blood vessels full. So they have an easier time pumping, and then increase salt and electrolytes. So again, only if your diet and the rest of your health allows it, those things can also help. So yeah, basically it's a decrease of blood flow to your head, and it all pools in your feet and it can't pump back up. So that happens to everyone to some degree, but in a normal working system, the blood vessels in your legs and your lower extremities, your feet will help pump everything back to your heart and head. And in POTS, it's not working properly. I think there's also some drug trials happening right now, but they're still in the trial phase. So I think Mount Sinai in New York City is doing some trials. And then I have a friend of a friend in Texas who's in a clinical trial for a medication for POTS. I think there's also some off-label medications, meaning there's a drug that we use for something else that is working on people with POTS. There's only a few doctors really that are working with this. I'll link some below. And again, if you know any resources that you've come across, please share them in the comments. Really, this is a resource to help people because, again, medical doctors don't really know. Is it their fault? Not really. They have a lot to do. But, I think long COVID is a big missed opportunity. I treat a lot of patients with like autoimmune disorders, chronic illnesses that we don't have answers for. And I was really hoping that one good thing would come out of COVID would be research for, again, chronic illnesses and things like that. And this current administration, that is their platform. Robert F. Kennedy Jr., the Health and Human Services Secretary, his platform was like, we're gonna help with chronic diseases, but they got rid of the long COVID office. They fired a bunch of researchers. They're cutting research money. So like, how are we supposed to help chronic illnesses if we don't have the money to study it, right? So the platform they ran on just it's not really what's happening in the real world. So I'm sure there's going to be commenters commenting on that. But that's the reality. Like I work in healthcare and like I want answers too. And so that's again what I'm finding as a practitioner, right? Like the most help I've gotten is from reading the research myself and from my physical therapy colleagues sending me resources and this lecture from a physical therapist on long COVID. So I want to help you guys help sort of navigate some of this information. And these are some things that you can do for POTS that can help you. So I hope that helps. Again, leave any resources in the comments.